Picture two scenarios. First, it's 1920. You get a deep cut on your finger while working in the garden. There are no antibiotics, no emergency rooms as we know them. You simply hope for the best. A week later, a raging infection takes your life. Now picture today, you're 75 years old. You've survived a cancer diagnosis that would have been a death sentence 50 years ago. You've had your hip replaced with a titanium joint, and you manage your high blood pressure with a single, inexpensive daily pill. The contrast is breathtaking. Modern medicine is, without a doubt, a miracle. It has doubled our average lifespan in just over a century. But this incredible progress has created a strange and troubling paradox. While we're living longer than ever before, are we actually living healthier? Why does a single hospital stay cost more than a new car? Why does it feel like the food on our grocery store shelves is working against our health? And how did we end up in an era where millions are kept alive, but depend on a daily cocktail of pharmaceuticals just to function? Today, we unravel the sweeping story of how healthcare has transformed and what it means for the health of every single one of us. Let's travel back to the early 20th century. Healthcare was not a system, it was a local doctor, often making house calls with a black bag containing little more than a stethoscope, a thermometer, and morphine. The feeling of helplessness in the face of serious illness was profound. The leading causes of death were swift and brutal assassins: pneumonia, tuberculosis, influenza, and waterborne diseases like cholera and typhoid. A simple case of strep throat could lead to rheumatic fever and a damaged heart. Childbirth was a leading cause of death for young women. Child mortality was tragically high. In 1900, nearly 1 in 10 infants didn't survive their first year. Then, two monumental shifts occurred. First came the revolution of public health. It wasn't a fancy drug or surgery, but something far more fundamental: clean water, effective sewage systems, pasteurization of milk, and basic hygiene campaigns. This was the first great leap, preventing sickness on a scale never before imagined. Then came the silver bullet: antibiotics. The discovery of penicillin in 1928 and its mass production in the 1940s was like unleashing a superpower against our oldest microbial enemies. Infections that were once a near-certain death sentence became treatable inconveniences. The impact was immediate and staggering. Alongside antibiotics, we developed vaccines. The terrifying sight of children paralyzed by polio, confined to iron lungs just to breathe, vanished from society. Measles, whooping cough, tetanus, diseases that once terrified every parent, were brought to their knees. During this golden age, healthcare costs were manageable. The tools were simple, the treatments were often definitive, and people paid their doctor directly. The focus was clear: to conquer the acute infectious diseases that had plagued humanity for all of time. And on that front, we were winning a spectacular victory. As we vanquished our oldest foes, a new, more subtle opponent emerged from the shadows. By living longer, we gave our bodies time to develop chronic, lifestyle-related illnesses: heart disease, cancer, stroke, and type 2 diabetes. You can't cure heart disease with a single shot. These conditions required a new, far more complex and expensive approach: long-term management, and this required a new system. This is where three major shifts happened that define our healthcare today. First, the insurance model took over. Instead of a direct transaction between patient and doctor, a third party, the insurance company, began paying the bills. This had a profound, unintended consequence. It disconnected us from the true cost of care. When you only pay a small copay, a $5,000 scan doesn't feel much different than a $500 one. This created what economists call moral hazard, a tendency to consume more of something when you don't feel the full price, which sent costs on a relentless upward march. Second, a medical arms race began. Hospitals started competing to have the newest, most impressive technology. MRI and CT scanners, bypass surgery equipment, robotic surgical arms. These technologies were incredible, but they came with massive price tags. Hospitals passed these costs on through higher prices for everything, creating a cycle of escalating expenses as each institution tried to outdo the others. Third, the pharmaceutical industry transformed. Drug companies saw an enormous new market, not curing a temporary infection, but managing a permanent condition. They moved from simple compounds to creating highly sophisticated, patentable drugs for blood pressure, cholesterol, anxiety, and ulcers. This was the birth of the blockbuster drug, a single medication like Tagamet or Valium that could generate billions in revenue. The business model began its subtle but critical shift from one-time cures to profitable long-term treatments. Which brings us to today. The system that began in the mid-20th century has metastasized into a massive, multi-trillion-dollar healthcare industrial complex. The problems of the earlier era have been magnified to an almost unimaginable degree. Let's talk about skyrocketing costs. In the US, healthcare spending has ballooned from 5% of GDP in 1960 to nearly 20% today. That's 1 out of every $5 in the entire economy. It's driven by a perfect storm: insanely expensive new drugs and technologies, an opaque insurance system that hides prices, and staggering administrative waste. Some studies suggest nearly a third of all healthcare spending goes not to care itself, but to billing, paperwork, and bureaucracy. A system with 1,000 leaky faucets. Now let's look at our food environment. This is a critical, often overlooked piece of the puzzle. While medicine was advancing, our food was actively being engineered to make us sick. Government dietary guidelines, like the original food pyramid, mistakenly demonized healthy fats and pushed a diet heavy in refined carbohydrates and grains. Food companies responded by creating an endless array of low-fat products, which they loaded with sugar and processed ingredients to make them palatable. They engineered hyper-palatable foods that are scientifically designed to bypass our body's fullness signals and trigger addictive pathways in the brain. We created a world where the most accessible and affordable food is often the most damaging, directly fueling the epidemic of obesity, diabetes, and inflammation that our healthcare system is now overwhelmed trying to manage. And this is where Big Pharma became the dominant player. In 1997, a rule change in the US allowed pharmaceutical companies to advertise directly to consumers. Suddenly, our TV screens were filled with happy people in sun-drenched fields, telling us to ask your doctor about the latest pill for everything from restless legs to high cholesterol. This created massive patient demand for the newest, most expensive brand-name drugs, even when older, cheaper alternatives were just as effective. The goal expanded from treating sickness to medicating risk factors for a lifetime, creating a permanent customer base. So here's the central paradox laid bare. It's the difference between lifespan and health span. We have been wildly successful at extending our lifespan, the total number of years we are alive. A person born today can expect to live decades longer than a person born in 1900. That is an undeniable, spectacular triumph of science and public health. But we have failed to equally extend our health span, the number of years we are alive in good health, free from chronic disease and disability. As the saying goes, we've added years to life, but not life to years. We've traded death from an acute infection in our 40s for a slow, managed decline from chronic disease in our 60s, 70s, and 80s. The average American over 65 now takes 4 or more prescription drugs. We are living longer, but we are also spending a larger percentage of our lives feeling sick, managing symptoms, and navigating a complex medical system. The system is designed to be a brilliant mechanic. It can perform incredible repairs when your body breaks down, but it's a terrible gardener. It's poorly designed to cultivate health and prevent the breakdown in the first place. It profits from sickness management, not from health creation. Faced with this massive, complex system, it's easy to feel powerless, but you're not. The power to change your health trajectory is more in your hands than you think. It requires a fundamental shift in mindset. 1. Become the CEO of your own health. Stop being a passive patient. Think of your body as your most important asset and your doctor as a highly skilled consultant. Before you accept a prescription or a procedure, ask questions. Why am I taking this? What are the lifestyle alternatives we can try first? What are the side effects, both short and long term? You are the one living in your body, 24/7. Take ownership. 2. Prioritize prevention with a vengeance. The most powerful medicine is found not in a pharmacy, but in your grocery store, your gym, and your bedroom. Make it your mission to focus on the fundamentals that prevent the chronic diseases our system is built to manage. Eat whole, unprocessed foods. Move your body every single day. Walking, lifting, stretching. Make sleep a non-negotiable priority. Find healthy ways to manage stress. These aren't soft suggestions. They are the most powerful, evidence-based health interventions available. 3. Question the dominant narrative. Be a critical consumer of both food and drug advertising. That new miracle pill or that heart-healthy cereal box is being marketed to you for profit, not necessarily for your optimal health. Learn to read ingredient labels, not just the flashy claims on the front of the box. Your health is your goal, not their quarterly earnings report. 4. Build your health team. A good primary care doctor is a crucial partner, but your team can be bigger. It might include a nutritionist who can guide your food choices, a physical therapist, a health coach, or even just a community of friends who support and share your healthy habits. You don't have to do it alone. The story of modern healthcare is one of breathtaking successes and profound systemic challenges. We've gained precious years of life, but we've often lost quality of health along the way. The path forward isn't about rejecting modern medicine. It's about integrating its emergency brilliance with a personal commitment to proactive, preventative health. The goal is to need that brilliant mechanic as rarely as possible. It's a future where our health span finally catches up to our lifespan. What's the biggest change you've seen in healthcare in your lifetime? Or what's one step you're taking to prioritize your health span? Share your story in the comments below. Your experience could be the spark that inspires someone else. If you found this video insightful, please hit that like button and subscribe for more deep dives into the systems that shape our world. Thanks for watching. Stay curious and stay healthy.